We'll talk about allergic rhinitis today. Allergic rhinitis, the reason why spring makes a lot of people sneeze and sometimes even cry. Rhinitis refers to the inflammation of the nasal passages. This can cause annoying symptoms including sneezing, itching, nasal congestion, runny nose, and postnasal drip, which is that sensation of mucus draining in the back of your throat from the sinuses. Allergic rhinitis is caused by a nasal reaction to small airborne particles called allergens, which are those substances that provoke an allergic reaction. In some people, these particles also cause reactions in the lungs and can cause asthma, or the eyes, causing what we know as allergic conjunctivitis or pink eye. The allergic reaction results from the activation of certain cells in the body that produce natural chemicals such as histamine, which cause symptoms like nasal congestion, itching, sneezing, and a runny nose. The symptoms of allergic rhinitis varies from person to person. Although the term rhinitis refers only to nasal symptoms, many people also have symptoms that affect the eyes, throat, and ears. Even sleep can be disrupted as well. Symptoms may include the following: watery nasal discharge, blocked nasal passages, sneezing, nasal itching, postnasal drip, even loss of taste and facial pressure or pain. Itchy red eyes, a feeling of grittiness in the eyes, swelling, and dark discoloration of the skin below the eyes can also be present. Sore throat, hoarse voice, congestion or popping of the ears, itching of the throat, or itching of the ears can happen as well. Mouth breathing, frequent awakening during sleep, daytime fatigue, trouble doing normal activities. There are multiple symptoms associated with allergic rhinitis. Your doctor can diagnose this by doing simply a physical examination and reviewing your symptoms. It is possible to identify the allergens or other triggers that provoke the rhinitis by remembering where you were, what you were doing before your symptoms started. Basically, keeping a diary of what you were doing, noting the time of the year when you have more symptoms, looking closely at the home, work, and school environments for potential allergens or exposures. Your doctor may suggest skin testing if your symptoms are not well controlled with medications or if it is not clear what is causing your symptoms. This involves an allergist putting tiny amounts of different allergens on your skin and observing which causes a reaction. Even blood tests are also available, although these are not needed in all situations. The treatment of allergic rhinitis includes reducing, obviously, the exposure to the allergens and other triggers in combination with medication therapy. In most people, this combination effectively controls the symptoms. Several different classes of medications can treat the inflammation that causes symptoms of allergic rhinitis. Some of those medications may include nasal glucocorticoids or steroids delivered by a nasal spray. These drugs have few side effects and dramatically relieve symptoms in most people. Some nasal steroids are available over the counter in the United States. Some of them are Flonase, Sensmist, or Rhinocor or Nasonex. Some people notice symptom relief using these medications on the first day of treatment, although it might take days to weeks to notice a full effect. For this reason, nasal steroids are mostly effective when used regularly. Some people are able to use lower doses when the symptoms are less severe. Nasal sprays work best when they are used properly and the medication remains in the nose rather than draining down the back of the throat. When you're doing this, hold your head straight with your chin slightly tucked. Point the spray away from the nasal septum. I'm going to show you with this. So I'm not going to put this in my nose, but what you're going to do is you're going to put the tip of the bottle not pointing towards the septum, but towards the outside. Because if you do it towards the septum, it's going to give you some irritation. Then you're going to squeeze the bottle and get the spray into your nose, and you are going to sniff slightly. Don't do it too hard because it's going to end up in the back of your throat, and you're not going to like it. You can pinch your nose slightly and keep it there for about 10 seconds so the medication works where it is supposed to work. If you do it correctly, then it's going to work better. Some people wonder about the side effects of steroids, and that's fair. It is true that steroids taken in other forms like a pill or inhaled into the lungs can have side effects, especially when taken for long periods of time. However, the doses used in nasal steroids are low and are not associated with these side effects. Other medications are antihistamines. They relieve the itching, sneezing, and runny nose of allergic rhinitis, but they do not relieve nasal congestion. Using them along with nasal steroids or decongestants may provide a better symptom relief than using one of those medications by themselves. Some may make you sleepy while others may not. Very common used medications of this kind, antihistamines, include medications like Claritin, Zyrtec, Allegra, Xyza. There are multiple of those, and these are the newer ones. There are older ones like Benadryl that can be used. However, the problem with this one is that it can make you sleepy. If you have itching or irritation of the eyes with your other allergy symptoms, you might be suggested prescriptions or over-the-counter antihistamine eye drops because they can help you with those symptoms as well. Some decongestants can be used as well. The decongestant Pseudoephedrine or Sudafed is available in combination with some antihistamines in some oral over-the-counter allergy medications. Rinsing the nose with a saline salt water solution is called a nasal irrigation or nasal lavage. You probably have heard that with a neti pot. This is particularly useful for treating postnasal drip, sneezing, nasal dryness, and congestion. The treatment helps by rinsing out all those substances or allergens out of the nose. Irrigation with warm saline can be performed once per day or twice if your symptoms are severe. This carries few risks when done correctly, and with saline, that is salt water made with sterilized water. Allergy shots, also known as allergen immune therapy, are only available for common allergens including pollen, cat or dog dander, dust mites, and molds. The shots contain solutions of the allergens to which you are allergic. Each injection is prepared specially for you. The process of immunotherapy changes your immune response to the allergens over time so that you can tolerate them better. As a result, being exposed to the allergen causes fewer symptoms and may even eliminate symptoms altogether. There might be other drugs that can be recommended for some people with allergic rhinitis too. These are the 5 things that I want you to remember about allergic rhinitis. Rhinitis is the inflammation of the inside of the nose. Allergens are particles in the air that cause allergies. Itchy, runny nose, and sneezing are part of the symptoms. Nasal steroids are the first line of treatment for this. Use them properly. And finally, allergy shots may be indicated because they could help a lot.